All right, so I want to pick up where we left off a little bit. Was having a conversation during lunch. How did I find my merry way into the world of ABA? And actually, it's a two-step process. I was working for a while back in 1988. I think it was that long ago. And I got a call from some friends that said, look, we're opening up some group homes in New Jersey, and we have some people who look an awful lot like Stephen, who you saw here. One of those was an individual named Teresa D, up in a group home in Denville, New Jersey. And Teresa wore a helmet. Anybody know what a helmet is? Right, one of those padded things. And she had been in she had the misfortune of being in the Northern New Jersey Training Center, which was a euphemism for a developmental center, which ironically, if you're ever in New Jersey and you take the Amtrak into New York City, you'll go past Rahway State Prison. It's very noticeable. Well, apparently when they were done building Rahway State Prison, the same people who constructed that went over next door and built the Woodbridge Developmental Center. It looks pretty much the same. And Terry had been there for many, many years, and she had a helmet on her head. She was nonverbal. She's a big girl. I'm going to say about 5'10", maybe about 180 pounds. And, you know, I thought, okay, she's got a helmet on. What's the big deal? And the state of New Jersey has actually they don't have a policy. They have a no hands-off policy, but they won't put it in writing, transferring the liability all over to the provider. And so we had a problem because Terry, as Vivian was talking about, had no way to let you know what she wanted other than to walk over and headbang you in the nose. And that would let you know that she would prefer that you not be there, aggressively. So we began to work with her, and the problem was that she was headbanging, and she had a rather unique discrimination. She would go and she would find really hard surfaces like corners of doors and walls and windows. And she was breaking facial bones, I believe it was between 1 to 7 times a week. A week, that's a lot. That's a lot of hospital bills. So I was very fortunate at the time. There was a psychologist who was a behavioral psychologist named Gregory Birch from up in Massachusetts. And he had this theory about communication, that all behavior was communication. How novel. But we began to work with Terry, and the beginning of the story was I remember going out one night as essentially an uncredentialed RBT under the supervision of Dr. Birch, and he said, well, what we're going to do is we're going to teach her how to communicate, and you're the we, because I'm going to be in Massachusetts, you'll do what I tell you. And I went out that first night I was going to help Terry make dinner for the group home, right? There was 6 people living in the group home, and we were going to have the very fancy French dish, Twig de Poisson. Fish sticks. And she was going to help me. Her whole task was to simply get those fish sticks on a cookie sheet. And so, here's the genius coming in, and here's Terry, and she's got her helmet, and she's not particularly interested in doing anything that I'm asking, but we're going to get this task done. We have to make fish sticks. Well, she didn't agree, vehemently. And so I still have the scars from where Terry had sufficient nails to explain to me that we're not making fish sticks. Damn it, we got the fish sticks into the oven, we closed the door, and then I went to bandage my bleeding hand. And that's where we started. And accidentally, we were very fortunate that we began to do things. We implemented something called a choice reinforcement procedure. Now, again, I'm not registered, I'm not a behavior analyst at this time, I'm just following instruction. But Dr. Birch had a pretty good familiarity with the research literature. He said, look, if you give people a choice, you very often will just get a reduction in severe behavior. Why don't we try it? So maybe she didn't like fish sticks. Maybe if you gave her a choice to make something else, macaroni and cheese, let's try it. And we began that very, very simple procedure, I'm going to say in about the month of October. Now, this was a woman that had a lot of legal from both the state and the private provider side looking to make sure that nobody was doing anything with her that was aversive, meaning that she didn't like. Well, that's kind of tough when somebody's headbanging your nose off your face, right? The nice ending of this story was we worked, and in fact, the fellow who is the chief program officer today is a fellow by the name of Tom Palermo. He was the group home manager at that group home, operated in the day by CHC. And we actually ran a very rigorous staff training program, and lo and behold, Terry stopped breaking facial bones within the first month. About 4 months in, I came over to the house and she recognized me, okay, great, this guy who represents a worsening set of conditions has re-entered my world. And she looked at me and she said in a voice that was kind of piercing, "I'll behave." She couldn't talk, she's nonverbal. And then progressively over the next few months, more vocalizations came out, just like you saw with Stephen. And what we came to find out was that the developmental center staff over time had implemented a procedure that was never written up, and we got this from her sister, that when she would misbehave and scratch the guy making fish sticks with her there, they would put the helmet on her. She would fight like all holy hell because they would basically put her in what we call contingent seclusion. They would lock her in a dark room until she stopped. And she would yell, "I'll behave, I'll behave, I'll behave," until she passed out and fell asleep, and then they would open the door and take her to bed. The nice ending of this story, again, keep in mind that all I'm doing is following the instructions of a very competent individual who's a psychologist to implement his protocols. Many, many months later, I guess probably about 3 years later, I'm moving on to a new place. And I'm at a workshop out in northern New Jersey, and I'm kind of saying goodbye to Jimmy. We've been working together, and somebody's tapping me on the shoulder. And I'm busy. I'm talking to Jimmy, and she's tapping me on the shoulder. And I didn't realize it was Terry, who was the quote-unquote monster, came over and just held out her hand. She recognized me at her workplace. And I stepped back, and I was really staggered. It, again, was not people who were bad doing bad things. It was people who were uninformed doing things that weren't scientifically based. And as best I know to this day, her headbanging behavior was gone, certainly no hospitalizations. Even in the final analysis of the data sets I was involved with, from time to time she would walk over to a wall and she would kind of go, "Ow," and then she would look around at everybody. And I was like, yeah, we're good. So before we start into the RBT task list, which is a dry exercise but an important one, the task list was established to determine, coming back to who I was working with Dr. Birch, how do I know that Terry has the knowledge needed to accurately implement the procedures that were designed in this plan? So it is pretty rigorous, but we got to take it one step at a time. I know there are several people here who are looking to obtain the credential. So what does it include? Well, the first section is on measurement. Why measurement? Why is it important? Because if you don't know where you start, and any place you end up is okay. Right? So we're going to measure baseline treatment outcome in the simplest terms. Prepare data for collection. We were having a conversation at dinner last night that one of the hardest things to do is when you are on the floor or in the classroom or in the ward, to collect data at the same time you're getting punched in the head, not so easy. You would like to get that data as soon as possible thereafter, but also importantly, if you've got skill acquisition, coming back to Jimmy and Vivian, asking people or prompting them to ask for things. You want to know about that adaptive stuff, not just the downside, you want the other side. What's the skill acquisition going on? The whole field of behavior analysis rests on data collection and the graphic representation of progress. The implementation of continuous measurement procedures, which is a fancy way of saying things such as frequency, how often over time, duration, how long. Now, how many in the audience are parents? Okay, do your kids scream when they're young? Is it a problem if they scream for 15, 20 seconds? You expect it. What if they scream for 15 or 20 minutes? So duration becomes a very important measure. Implement discontinuous measurement procedures. That's a mouthful. Partial interval, whole interval, sampling, etc. There are different ways to measure behavior, and sometimes you have to take into consideration the realities of the programs that you're working in. You may or may not have somebody who can sit there for the whole half hour and make a check mark because the behavior occurred once in that whole half hour. You might only have somebody that can be present for 4 or 5 minutes. And even in that 4 or 5 minutes, there's different ways that you might measure. Did it happen for the whole 4 or 5 minutes? Did it happen once in the 4 or 5 minutes? And technologically, this is an important item. Implement permanent product recording procedures. I've often wondered, permanent product essentially just means it's not going anywhere. Why don't they just use language like write it down? But there you have it. Enter data and update graphs. Very, very critical function of the registered behavior tech. Enter data and update graphs. How many people here graph daily? So maybe that's 5% of the audience. A quick story, I was called into a County Ed Services Commission in New Jersey who held themselves out to say that they were doing ABA, and they had a school principal who was a BCBA, and there's not many of those who hold both credentials. And I asked a question at an in-service training of the parents, because I was supposed to do a parent training. I said, well, how often do you guys see the graphic representation of your children's progress? I was such a popular guy with administration. So at the break, the school principal came up and explained to me that, obviously I didn't understand because she was both a principal and a BCBA, and I said, your lucky day. I'm the other guy that's got both of those. But I asked her, I said, you're a BCBA. I said, how can you say that you're running an ABA program when you don't give graphic representation of progress? And she was really offended. At the end of the presentation, a couple of parents came up and said, what do you mean? And I said, well, if you have a child and you've placed them in this program because it's been represented to you that it's an ABA program, that requires that you get regular graphic representation of progress. If you're not getting it, you got a couple of choices, but what I will tell you is you bought something you're not getting. So, needless to say, I never went back to the Ed Services Commission again. The RBT task relative to assessment, describe the behavior and the environment in observable and measurable terms. There are different principles in behavior analysis, one of which is we seek to always use observable behavior. The example that I like that I think Skinner said, but Jimmy will correct me because he's the master of Skinner, was someone basically once said, are you saying that thought doesn't occur? And he said, no, I'm not saying that thought doesn't occur. I'm saying tell me how we alter the behavior unless we see the result of that thought. It sounds kind of goofy, but if you spend some time thinking about it, if somebody says to you, I'm going to assume there was a lot of parents in here, that your kid is very anxious, and that's why they're doing X, Y, and Z behavior. Have they given you anything to work with? Why not? What does anxious look like, right? And so unfortunately, if you're going into situations where you can't observe the behavior, how do you measure it? And if you can't measure it and observe it, how do you change it? Not to say that there isn't some internal event called thought that may be evoking this behavior, but until it's exhibited, what do you do with it? Conduct preference assessments. I talked a little bit just now about Terry D. and the choice reinforcement procedure. Well, I use strawberries as an example. I grew up in the summers out on a farm where my grandfather had a lot of strawberries. Now, he was full-blooded Cherokee, and that was considered kind of a holy food. He loved his Cherokees. Cherokee cherries or strawberries, they were just everywhere all the time, and I hated the fuzzy foods. I just couldn't stand them. But if I said to this audience, how many of you love Godiva chocolate-covered strawberries? Big show of hands? Right. Offer me that to come back, I'm running. And that's important information to know, because it's back to the points that Vivian and Jimmy were making, is what is really a reinforcer? And how do you know? It's specific to the individual. So an RBT will be conducting preference assessments. Assist with individualized assessment procedures. Some of them are curriculum-based, some of them are specific to social skills. This is to help, right? It's not to run a functional assessment. Functional assessment for our behavior plan in the world of ABA, that's the golden standard. And there's different types, but essentially the logic behind a functional assessment is that the behavior is functional to the learner. And that's a big deal, right? It gets out of the world of anecdotal. Jeffrey does this because it's a cloudy day, because his wife doesn't love him, because his mommy didn't clothe him. All that stuff goes away when you get into the functional analysis of behavior, because it's defined by research as to what's the function. Dependent upon the function, the research will drive you as to what to do about it. So you will assist with those procedures, and that may be things like withholding attention, putting a demand in place to see what happens, leaving somebody alone to see if they'll exhibit the behavior when they're in an alone condition. Again, that will drive the function, which will drive the behavior plan if it's done correctly. So here are the skills, and there's a lot of them, and I'm going to ask Jimmy to comment a little bit about how this interfaces. Skill acquisition for an RBT is pretty ambitious. Identify the components of a written skill acquisition plan. prepare for the session as required by the plan. So if the plan says Jimmy will earn an M&M at the end of producing some outcome, there better be M&Ms there, right? There better also be the instructional materials that are used to run the session. Use the contingencies of reinforcement, for example, conditioned or unconditioned reinforcement and different schedules of reinforcement. Implement discrete trial teaching procedures. Implement naturalistic teaching procedures, such as incidental. I catch you doing something right. That's an incidental teaching opportunity. ABA's language is a killer. So if you're looking at it as an RBT person, think about studying for French and then studying behavioral procedures. Implement task-analyzed chaining procedures. Again, the language is difficult. What it's getting at is implement task-analyzed. You've actually taken a look at what are the components of the task and how do they fit together. That's chaining. Implement discrimination training. Implement stimulus control transfer procedures. Implement stimulus fading procedures. Implement prompt and prompt fading procedures. Implement generalization and maintenance, et cetera, and so forth. So if you were thinking coming in here that you wanted to be an RBT and you just didn't bolt out the door, you're in very good shape. Is that a lot of knowledge? Can it be acquired over a 40-hour educational instructionary period? Probably, right? Because there's 26,500 people that have done it in the past couple of years. And I wanted to ask Jimmy to touch on a point that he brought up. After you're done learning this stuff, you have to demonstrate it to a BCBA, right? And so there's two different methods that you can demonstrate the competency. But you may be asked to demonstrate a competency that includes 2 or 3 of these all together in one spot. So you want to talk a little bit about that?
Yeah. So I think the point that Terry's trying to make here is that for the skill acquisition stuff, it's just one set of repertoire. So if I ask someone what's the stimulus control procedure, they can actually verbally say it, which is completely different than actually doing it. Vivian earlier was talking about hold up the item, and then when the individual says it, deliver the reinforcer, which is completely different than actually being in it. These are some of the skills, like what's in the competency assessment is that even though there are 12 different areas to be overlooked by a BCBA, you might have to identify, you might have to be able to engage in one of a subset of behaviors, which is kind of icky if you think about it for those of us who are supervising RBTs. In order for someone to say you have this skill, it's not specifically drawn out. So I think Terry's going to pull it up after. It's okay. No, just go back. When you're doing this competency assessment, you don't have to specifically demonstrate each one of these skills, and that's kind of problematic for someone who's a board certified. I think Terry's going to pull it up. I just want to show you.
So the task list is associated with what? It's associated with making sure, because think about the application of being an RBT in a situation where you're working on a home case. You know, a home case might be a child who has a developmental disability, and the lead on the case is Vivian or Dr. Kaori, and they're instructing me now as the RBT, okay, here's the plan, let's run through it. I want you to implement this plan in my absence. I'm going to be with you for the first hour or 2, but then for the next 10 hours of the week, maybe in 2-hour sessions, 5 days for the week, you're the person in the mud implementing the plan. If you don't have this knowledge, what happens if you go off script? So think about that. So I have a plan that says when Jimmy throws his stuff on the floor, I'm going to give him a contingent effort procedure to tell him another way to let me know that he'd like to shorten the duration of the task. So I follow the script, but all of a sudden, Jimmy doesn't throw his blocks on the floor. He just simply sweeps them across the table. What do I do if I'm bound to what's written in the plan as a RBT? And I can't get a hold of Vivian on the phone. What am I supposed to do? Just stop? So these are the competencies that are referenced here.
Okay, so just really quick. So notice there was 12 different areas in the skill acquisition. But for the actual competency assessment, all you really have are 3 general areas. So when people are actually taking the test, you are testing one specific set of skills. You know, I can explain reinforcement, I can explain punishment and extinction, but doing it is a completely different subset. So here, if you notice here, when they do the competency assessment, they're not assessing everything. So in order to get credit here, you have to do either one of these three. I want someone who can do all of them, because at any given moment, you might be doing all these different procedures. And I think it's one of the areas that the BACB hasn't worked out yet, and I think that's going to come.
So sticking with that, one of the questions that came up last evening, speaking to somebody who is an RBT and has been now, I think, for 2 years, was do RBTs have to do continuing education events, such as this? The answer was no, you're retested every year. I thought about, wow, that's pretty intense, but it comes right to Jimmy's point. If the science evolves and the task requirements that are here change, it's kind of smart as well, because you can alter your testing criteria from year to year without getting stuck. So I'm getting the after lunch stare. There is coffee outside, by the way. So RBT thus far, right? We went over the requirements. You got to be at least 18 years old, have a high school or a high school equivalency. Anything else? Pass a criminal background check. What other pieces? 40-hour education by a BCBA. Is there anything else? Show your competencies how? Right, through the supervised practicum, so to speak. And you can do that, as you saw here, you can do it two ways. I can say, show me what does it look like discriminatory reinforcement. Or I can say, role play for me, how you might show that you're going to reinforce on a specific behavior. So there's two options there. So again, back to this task list. There's a lot in here. The good news is, if 26,000 people passed it in the past 2 years, so can you. So the next one gets into, I think ABA gets known for behavior reduction predominantly. People with very severe behavior cost an awful lot of money in this country. I forget the number, Lois might remember it, but I think it's the top 2%, or cost some ridiculous number like over $2 billion. Right, and typically those behaviors look like our friend Stephen, right? I heard in my prior history, when the guy with the tie approaches me, life is getting worse, so let me punch myself in the eyeball, because he'll learn that when there's my eye clouds up with blood, if he backs off, I stop hitting myself. Those types of behaviors start typically fairly early, but if they're not addressed behaviorally, they can be accidentally reinforced over time. Very often, as a behavior analyst, we see very, very well-intentioned parents, quote unquote, creating the monsters, right? Because they mean to do the right thing by their kids, but when their kid screams and makes a demand, what do? Inadvertently, they reinforce the behavior by giving in. And when the kid is 4 or 5, Vivian used the term cupcake. I always refer to a cupcake kid as somebody that you could pick up and move. Once that stage is gone, and you're now my size and mom is Vivian's size, what happens when Junior wants what he wants when he wants it, and there's a 20-year history that I've given in? It's not going to be so easy to get rid of that. So behavior reduction, identify the components of a written behavior plan, describe common functions of a behavior, meaning, is it attention maintained or access to reinforcement, both in the same functional response class? Is it escape maintained, or is it automatic? It would happen at the same or higher levels whether or not people were in the room. Implement interventions based on modification of antecedents. Antecedents are things that happen before a behavior, such as motivating or establishing operations and discriminative stimuli. That may be the best example I've ever read of non-user-friendly English. Implement differential reinforcement procedures. That's a techie term to essentially say implement reinforcement either as an alternative or as for other behaviors. There's other variations of that schedule. Implement extinction procedures. Extinction, yet again, another ABA term, meaning in English, don't deliver the reinforcement that in the past has kept the behavior alive. It requires that you identify what that reinforcement was to be able to remove it. Now the challenge with that, I always use the paycheck example. Are most of the people in here on a payroll? Yeah. So payroll with Chimes comes out, I believe, on a Wednesday or a Thursday. Let's call it a Thursday. What happens if there's no pay in the bank? Now we got electronic, so it changes a little bit. But let's use the old-fashioned paper payroll check. On Thursday, Paul is supposed to get his check, and there's no check. On Friday, he's looking for his check, and there's no check. On Monday when he comes in, what's the first thing he's doing? He's looking for his check. There's no check. What's he doing on Tuesday? He's exhibiting new and novel behavior to find that check, right? Now on Wednesday, there's still no check. What's going on? He's going to crank up the volume. He's going to be at my office. He's going to be at HR's office. By Friday, there's still no check. So now he's making new and novel phone calls to places like the Department of Labor. What's happening is what's known as an extinction burst. He was on a schedule every 2 weeks, I get a check. I get a check, I get a check. Life goes on. There's no behavior associated with it that's maladaptive. But when that behavior of obtaining the reinforcement known as check is gone, we can anticipate there's going to be a burst of other behaviors, right? And so that's very important. I would say that's probably one of the key critical things to know about doing a behavior reduction plan is to anticipate the extinction burst, right? If it's a method of communicating to you that this is what I've been reinforced for in the past, anticipate and tell your staff in advance you're going to get an extinction burst, usually 3 to 7 days. If they know it's coming, they're not going to be happy about it, but they'll make it through. Implement crisis emergency procedures according to a protocol, also extremely important. The RBT task, document reporting. Report other variables that may affect the client. Right before coming here, I'm trying to think, no, she's not here today. We had a dad who was very upset because some maladaptive behavior was happening with his kid, and he was absolutely convinced it was a medication issue. When we researched it, that hadn't changed. In that particular program, had it changed, it would have been, because of this, documented, right, as a variable that might change behavior. Generate objective session notes, objective, by describing what occurred. Effectively communicate with your supervisor, comply with applicable legal, regulatory, et cetera, law. Comply with all applicable legal, regulatory, and workplace requirements for data collection, storage, and transportation. That's a tricky one, but an important one. In Westchester County, New York, I recall on behavior plans for kids in early intervention and state ed programs, you had to hold on to the data for 12 years. Most places it's 7 years, but think about that. If you didn't know that, and you got done working on a case and you simply threw it out, and all of a sudden a lawyer comes along because mom and dad are filing for some action on each other, it's a challenge. So important to have that awareness. The next RBT task is professional conduct and scope of practice. You must be able to describe the role of the RBT and respond appropriately to feedback and maintain or improve your performance. So when I'm supervising you as your RBT supervisor and I say, look, you did really well on this side, you could pick it up a little bit on this side, running out of the room, I've had it, is not the applicable professional conduct that's sought, right? The ability to process feedback is an important piece. Communicate with stakeholders as authorized. Now this one, I think one of the biggest challenges is very often you're the RBT, you're out there in the field, and the family very often is desperate for help. And all of a sudden, the relationship out of the gate starts off very differently. You're the savior. So I call it professional distancing. Very important to keep in mind that you're there working as a member of a team to deliver a professional service. You are not the be-all and the end-all of the family to solve all of their problems. You're not their counselor, marriage or otherwise. You're there to be delivering behavior services. Which leads into maintain professional boundaries, and sometimes that's very, very difficult. Maintain client dignity. I think Vivian did a really nice example on that one about knocking on the door of the people's houses you're entering. The role of the RBT in service delivery. Tiered model service is the common practice. More cost-effective levels of service for the duration of treatment. What I think that's speaking to is that if you have one BCBA for 20 hours a week on a case, it's not sustainable by a family or insurance companies, right? So again, back to what I think is a brilliant move on the part of the Behavior Analyst Certification Board, integrate the RBT into your teams so they can be sustainable over time. The use of tiered service delivery models enables healthcare funders and managers to assure adequate provider networks and deliver medically necessary treatment. That last line is an extremely important phrase, medically necessary. Anybody know why that's important today? Rochelle? Right. Right, and also very often if you're going into a managed care environment, if it's not, quote, medically necessary, they're not paying for it. Unless you scream with a congressman, right? That helps. It additionally permits sufficient expertise to be delivered to each client at the level needed to reach their treatment goals. This is critical at the level of supervision required, and it may shift rapidly in response to client progress or need. Tiered service delivery models can also help with treatment delivered to families in rural and unserved areas, as well as clients and families who have complex needs. The RBT training for families, I still come back to this over and over again. I could have the dream team in my house for 20 hours a week. So maybe that covers Saturday through Friday, 3 hours a day. I've got Saul as the lead BCBA, or Vivian or Jimmy, or what happens for the rest of that week? There's a lot of other hours uncovered. So the RBT coming back to the core competencies that are developed by the credential don't necessarily mean that you have to seek out a BCBA to supervise you. The educational component itself may be sufficient. So here's what the tiered service delivery model means in English and looks like. Board certified behavior analyst provides clinical direction, supervision, and case management. Now in this example, that BCBA is supervising 4 RBTs, right? Is that an unreasonable caseload for a behavior analyst to supervise? Probably not, probably very doable. A different route could be the integration of a board certified assistant behavior analyst, so now you're up to 6. Still very doable. And here's where the rubber hits the road on supervision. The RBT must receive ongoing supervision. Note that word, ongoing. It's not a one-time event. It's not the assessment. By a certificate, meaning a BCBA, for a minimum of 5% of the hours spent providing ABA per month, including at least 2 face-to-face supervisory contacts. Is that a tough standard? You bet, right? So think about Texas and Alaska. Geography is a little bit more spread out there. Is that a tough standard? It is. I think if you really go to the Behavior Analyst Board's website and look at this, they've made accommodations for geographic issues, but they're sticking to the 5% of the hours must be supervised. So on a 20-hour case, how many hours am I spending as the BCBA face-to-face with the RBT? Right, for every 20 hours. So in a 2-week period, I gotta have 2 hours. Right, that's hard. You get snowstorms, even down here. You get illness, different things happen. Be aware of this, whether you're a BCBA or an RBT. In my mind, that's probably the biggest ongoing hurdle to overcome, is to make sure that appropriate supervision is set up out of the gate and maintained. Abide as an RBT of the BACB's professional and ethical compliance codes. And then we go into the pros and cons of RBTs. So having spoken a lot, I know that you don't ask after lunch, does anyone have any questions? Instead, you ask, what questions do you have? Or you punt to somebody who's already doing some of this work as an RBT. But Saul, what do you got?
The RBT looks very impressive. Who came up with these criteria?
Let me give you this.
The RBT looks really impressive to me. We have this huge problem getting qualified people, and it looks like it's double the number of people we have in the field. The criteria are very impressively written. Who's responsible for that?
It's the BACB.
Okay.
Got their own group.
Okay.
Right, Jimmy?
Yeah, what they do is every few years they get together and they figure out, they're constantly for those who are board certified, there's a task list and it goes through different iterations. So every few years or so, a group of people, professionals and some other disciplines get together and they figure out what is the bare bones minimal needed to be an RBT. So it is a constant work in progress and it's handled through the BACB. So this is not the end-all be-all. I'm sure there's going to be numerous iterations. Just a personal story, when I first was in behavior analysis. Back in the 90s, I read Catherine Maurice's Let Me Hear Your Voice. And at the school that I was at, I went to the back of the appendix and I said, I'm going to do this stuff that I read in a book with the guys that I work with, and I became the ABA expert, because I'd read a book and I was doing these really cool things. And the school that I was at, that's Jimmy, that's the ABA expert. He's the ABA lead therapist, and I didn't know anything about applied behavior analysis. So when the certification board came out, I'm like, wow, this is going to be nothing. And then when I actually looked at what was involved, I realized, like, oh my God, I don't know this stuff. And I hear a lot of people sometimes say, I want to do that thing you do. And they think you kind of take a test and everything is great, but it took me 20 years and I'm learning this stuff every day. And it's similar with RBT. People say, I want to be an RBT. And they just think, yeah, I sit at a table and I give cookies and everything is great, but there's a lot of, there's a lot of work involved. And I think, as a profession and a science, we're having much more respect for ourselves so that people can't just be going out there and doing some really awful things in the name of applied behavior analysis. When I first got in the tail end of it in the early 2000s, it was like the Wild West. You went to a workshop and you could say, I'm ABA trained. There's some people that I still interact with who go, yeah, I know that ABA stuff. That's where you give the cookies and the token system. So this is we're moving in the right direction. You're welcome.
Sure, you got a question?
More like a comment of something that I'm running into as an issue. So I work for the Children's Guild in a school of, well, up to 120 students. I'm the BCBA, and we are now encouraging everybody to become RBTs. Well, we've got 80 people, 80 employees, and at least 40 of them would ideally be RBTs. How are we going to supervise them? This is a really big deal because we've also implemented a discrete trial training program for the K through 2 kids, and we're talking about now RBTs who are working 35 hours of behavior analytical services per week. If you do the math, I'm going to top out any day just from the really, the folks who are just really going for it. So that's going to be our biggest problem, I think.
So there is a behavior analyst that I worked with, was a BCABA, and she had a similar problem. She's a great special ed teacher. She was very involved with her district union, and her district decided that she was going to supervise every RBT back in the day in her district. And because she was a BCABA, I was signing off on her supervision. And so we had to have a conversation that essentially went like this: Darcy, are you a fireman or are you a BCBA? Because your certification is tied to your representation, and mine to yours, that you're appropriately handling and supervising these people that you're calling underneath you. And the district wanted to take it another step, and they wanted to represent that because she was the one BCBA in district, that they had a quote-unquote district ABA program. So it became a very challenging situation because she was saying, if I say no to them, I lose my job. And I said, and if you say yes to them, you lose your certification. And we are, as a field, going to wrestle with this because, quite frankly, educational administration doesn't get what we do. Somebody made this point over lunch. I think it was Paul was talking about, you could go into a district with the best data books in the world, but if the superintendent and school principals don't understand it when they open it, take them to court because they don't have anybody in the district that can interpret it. You're not alone. I've run into several very competent people who are positioned, their district says, look, you're the BCBA? Okay, you're responsible for all of the district's behavior analysis programs. That puts you in a very difficult spot if there's an ethics violation complaint filed.
At SUS, we're going through this, and before we started doing the kind of rolling out the ABA across the whole agency, no one wanted us. Nobody cared who we were and or was interested in what we had to say. And then when they saw the product, right, when they weren't getting beat up, they were much more interested. And so now there's this major crossover in interest where people who were running programs in our agency, it's called the program director, are now asking, like, can we be an RBT or can we be a BCBA? And we also have shift supervisors. So so everybody wants to do it. And there's not many of us that are BCBAs. And so we're running across this, and there's a couple of things that we're doing to work around it because HR says we can't tell people they can't be that, right? So that's the lucky position I get to be in. And so one of the things we talk about is now there's a need, right? So you have to make that decision. So my supervisor, who's a psychologist but not a BCBA, will say, well, Vivian, we still have, smaller caseloads than the other agencies. And I said, well, we don't compare ourselves down either, right? You want to compare up. So if you're looking for quality, then you're going to keep larger caseloads. The RBT is really helpful for that consistency, because when you're not there, they could run in and help, right? But then what you have to recognize from that senior level, that administrative level, is that you have to now hire someone who just supervises. So that's one kind of discussion. The other thing that we're wrestling with is if we put them through the course but don't actually make them take the test, that I'm not tied to supervising them, but they have the knowledge. So that's something else that we're sort of playing with. Not that we're telling people not to go into the field, but because really their focus is still management and they really want to still stay on that side, but they're using this information to help manage the situations. We're kind of looking at that, so maybe that helps a little.
So actually, I had imposed, I was going to call on you next. So let me get you a microphone.
To add to what Vivian said, that having the people take that course just to get the knowledge in the public school system works out well too, because taking that test, or having taken that test after I've been working with special needs, special ed for 20 years. I do not have a BCBA, I'm an RBT. However, the test is not easy. If you don't have an ABA background, you know what I mean? So a lot of times, like like there's this big whirlwind going on, like, oh, everybody should get it, like in a school district, and like the principal of one of my schools said to me, well, you're going to work yourself right out of a job. But not really, because like the typical paras in the classroom who would take this test and would gain so much from the knowledge may not pass that test because they don't know the specifics list that you all saw on here about ABA. So they don't have all that knowledge. It does deliver some of that knowledge within the coursework, and the videos that you see, they label everything. There's no hands-on, there's no hearing it repetitively. Over 20 years, I don't know everything. Like Jimmy said, you learn every day. Every student that you get, every client that you get, you learn something different every day from it. I think it would be really good for the administration to take this course, because as some of the staff says in public school districts, why am I taking all this data? Nobody even opens the book. So, and this is a concern also legally, as they were talking about before, that in a good percentage of public schools, nobody even knows how to read that data. Nobody knows that when you have a program, an ABA program running for a student, and they're flatlining, that something has to change up with that teaching. Like, you can't just, oh, she hasn't gotten this, she's been at 0 for 3 weeks. It's not the child's fault, like this, but actually nobody's being held accountable. So the administration nobody looks in these books. Sometimes the teachers aren't looking at the books, and you got the paras just running the same programs week after week after week after week, sharing cookies with the kids. And it's, so it's the knowledge is good. That was my point there. I think it does a lot of good in the public school, and it's not just for the ABA programs. It also works for the kids in the regular classrooms that are ADHD. And you have a whole gamut of stuff going on in public school that it works for.
Thank you, Kathy. So Kathy's actually, for those of you who are considering the RBT credential, Kathy and I have worked together. Kathy's RBT is supervised by Vivian, so I think she's in pretty good shape. Talk to Kathy about what does life look like? A real question?
So a lot of the insurance companies now are requiring the BCBAs or the assessment, the oversight, and program development. What are the insurance companies saying that has RBT being the right era?
I actually know that answer. I saw a correspondence from Magellan Behavioral Health. Does anyone know them? They're fairly huge. I believe, where's Chris Kelly? I think it was the beginning of this year that any ABA team requires the RBT for anyone who's on it or a BCBA. The Magellan Behavioral Health, the memo they sent out, effective January 1st of the current year, you must have, or they will not engage you as a paid person on the team. So if you're doing treatment out in the community, and this is a risk, there's a whole nasty side to this on the insurance side that deals with a medical credential that you don't want me to even go into, that essentially assumes if you're a BCBA and you're out there practicing in a non-licensed state, there's a whole group of people that want to come after you for practicing medicine without a license. But let's assume in Maryland you have a license and you're doing it the right way. If you bill for a person on your team who's not an RBT, the best you're going to get is that you won't be paid for it. The other side of it is that you've billed for an uncertified service, an unlicensed service, and inappropriately billed under your quote-unquote license as a behavior analyst. And that gets really ugly. So let's not even go there. The pros of the RBT, the right to effective treatment. Behavior analysts have a professional obligation to make the most effective treatment that the discipline can provide to direct both the ethical and appropriate application of behavioral treatment. This is an article that Jimmy was referencing, so he was telling me in brief what it meant from Richard Fox, so I'm going to actually ask him to kind of see, he's just loving the public speaking opportunities.
So about 20 years ago, when the behavior analyst Richard Fox wrote 20 years of treating severe problem behavior, lessons learned, and I read it every year because I think it's a really good article. It kind of takes the temperature of where we were 20 years ago and where we are 20 years now. So he identifies about 15 or 16 areas of some issues with applied behavior analysis and treating problem behavior. So of the 16, there's 3 of them that I think the RBT credential actually addresses. First one he talks about is that every place cannot provide treatment. I think that, having someone who has these knowledge and skills can do that. I think the RBT helps out with that. No behavioral expertise is available, Some of these programs are recommending 40 hours. So, it's the RBTs who can kind of go out there and be the representative of those BCBAs, and there's no expert who can conduct treatment or becomes a circuit rider, Some of us who are out there are times where our day is just putting out fires. We're trying to address these things as they come up. The RBTs are those guys out there who are in the trenches also with us. Kathy, I'm sure, can attest to that. So I think the RBT is moving in the right direction, as it was addressed some 20 years ago. For those of you who are board certified, I highly recommend the article. It's a really great read. Who wrote the right to effective treatment? Oh yeah, you wrote that. That's right.
Jimmy gave a nice plug. We had Chimes is a very large agency with 4,000 employees, and Lois, having started the Learning Collaborative, we had a really rather unique experience. Was it 2 weeks ago, I think, right? Tuesday, where Saul called in to talk about the right to effective treatment, because I was kind of going through, I'm a nerd, I read behavior stuff at night, and I was rereading the right to effective treatment, and it really jumped out at me in so many regards about homeless families, the people we serve with mental illness. There was so much in there. One of the other authors was a fellow by the name of Brian Iwata, and so imagine our surprise when we actually got on a phone call of the Learning Collaborative, and 2 of the original authors were on that call to describe the impact, what it felt like to write an article that's really had such a tremendous impact both on the field and on the community that we live in. So Richard Fox's article, Lessons Learned 1996. For those of you who are BCBAs and members of ABAI, Applied Behavior Analysis International, you probably get a journal called Behavior Analysis Practice, and this was an article that came out in the summer, I think, right, Jim? Yeah. Basically, kvetching, for those of you who know a little Yiddish, about RBTs. We don't like them, we don't want them, and here's why. Well, in the same group, there's a follow-up article. This is the same group that was basically moaning and complaining about the BCBAs years ago. I read both articles. I thought that the refutation of the complaints was well done, and more or less said, look, you guys, if you were out walking on water, you'd be complaining that somebody was not able to swim. So I landed on that. I thought that the Behavior Analyst Board did a nice job of responding to it. So the references for today are all listed. I think you guys have it in your handouts. I want to close out with a couple of housekeeping items. We do have a gala. There's signs all over the place. For those of you who remember who Joan Jett was, she's still a rocker. And so, see all those people with the orange shirts in the back? They would love you to ask them questions about the gala. Debbie Phelps, mother of the Michael Phelps, is the honoree. I had the opportunity to meet with her, and it was really exciting. My wife is not a sports fan, but there was something about this guy, Michael, swimming during the summer. And it was like, I don't know what was going on, but all of a sudden, shh, Michael's swimming. And everything had to be very sacred and holy and quiet. And so when I got to meet Deborah down here, because it turns out that Deborah Phelps is a middle school administrator, and she has quite a story to tell. There was a daughter that I had never heard of who was tracking to be Michael as a swimmer, and then was involved in a car accident at about the same time that her husband, who was a state trooper, walked out on her, at about the same time that she was a middle school administrator being told, you know, cut your budget and take these behaviorally disturbed kids. And then they came in to say, and by the way, Michael's got this problem, you need to get him on medication, he's hyperactive. And she said, no, I know how to get rid of that energy, I'll put him in a pool. And I said, well, I guess that kind of worked out pretty good, didn't it? So if you're inclined, there's information on the gala. It's the evening of November the 18th. And are there further questions?